Anywhere on the face is risky if you're worried about, going severe complications.
There are people that's getting it from just Shopee.
Even if a complication does arise with botulinum toxin injections, they will all be resolved in 4 to 6 months.
We doctors are given the privilege to inject, not because we know how to inject, but because we know when not to inject.
I think that's something else, like a really red flag for you.
Now, let's talk about under-eye fillers and eye safety with Dr. Stephanie in this particular situation. I think the concept of having any sort of injectables near the eyes is quite a daunting thought. But why are under-eye fillers considered more delicate or risky compared to other areas?
Well, I think for under-eye fillers, it's a difficult area to treat because of the anatomy, the skin is thinner. And I think we have to differentiate being difficult to treat versus risky. There are actually other risky areas on the face, like the glabella, which is, the part between our brows, or the nose, or the nasolabial fold, so-called the laugh lines, and the temples. So I think these areas of the face, basically anywhere on the face is risky if you're worried about, going severe complications like vascular occlusion causing blindness. In terms of the under-eye area being difficult to treat, well, because the skin is thinner, the anatomy there is difficult, patients do tend to, complain of swelling, Tyndall's effect, meaning, they can see the bluish tinge of the filler, or filler migration, or just not properly done filler. So I think that's why under eye is always considered challenging. But in terms of risky, I would say that there are other areas on the face that are just as risky.
Understandable. And you said something about blindness. Now, I know that would be something that a lot of questions popping up in a lot of people's minds, especially if you want to do any procedures around your eyes. Do you mind explaining, Dr. Stephanie, in simple terms, how complications like vision loss or blindness can actually happen with injectables?
Yeah, so blindness from any injectable is the worst complication that can happen. So how that happens is that the injectable, their products, and sometimes bits of it, what we call embolus, can break off and go into a blood vessel, because our face with blood vessels everywhere. And sometimes it travels backwards, and if it does get into one of the smaller arteries like the ophthalmic artery or the retinal artery, it will block blood supply. And that's how, if our eyes lose oxygen for a certain amount of time, we can go blind.
I see. Okay. And so with that, what are some of the warning signs that patients should watch for right after doing an under-eye injection?
Like I said, not just the under eye, but anywhere on the face, there's a possible risk of blindness. I think when visual loss happens, it does happen quite fast and quite soon. So if there's any visual disturbance at all, the patient should inform the injector, and the injector should stop immediately and assess the situation.
Okay, noted.
And if they feel any pain around the eyes, or they can't move, or they feel uncomfortable, do just voice out any discomfort.
Absolutely. You can stop the procedure if you need to. Know your rights as a patient. This is the only way for you to communicate with your doctor. Wave, say help, or stop, or anything of the sort. I'm going to move on to skin health and prevention. When it comes to dermatology, I think one of the things that as patients, we always want to meet the doctor, but we don't necessarily know what to say per se or know what to ask. So what's the safest practices or questions that patients should ask before agreeing to an injectable procedure?
To answer your questions, generally, even before you step into the clinic, you should have start asking about the qualifications of the people that you want to visit. So nowadays, that people are doing it a lot, like going to a hotel room, going to some funny housing areas and get things done. I think that's something else, like a really red flag for you. You are not supposed to do that. So the first thing that you want to highlight is actually the qualification. So in Singapore, in Malaysia, we have the medical council. You can easily check our qualifications from medical councils. Only doctors are supposed to do any injectables. That's something else that you really need to make sure that is there. Alright, and in terms of if there's any emergency, at least you know that these people, they are well trained, they will be able to address that. I think that's something else very important. If you're looking for specialists, there are certain specialist registry same thing in Singapore or Malaysia. We both have the specialist registry as well. You can go into that to look at the qualifications, whether they are well qualified before embarking into that particular place to start your consultations. So when you're going to your consultations, I think there are a few things that's very important as well. First, I think you will want to also know what type of products that the doctor is providing to you. So there are people that's getting it from just Shopee that gives you this kind of a problem because the quality control is not there. So I usually will say that look at the products, whether these products are genuine. There are attempts from the distributors that put in the original like stickers that tells you that it is. You can even scan it and find out whether these products are actually legit and stuff like that. So these kind of products are usually the safer products for you to use, and these are the things that perhaps you can try to get your doctors to explain to you as well. Yeah.
Thank you so much, Dr. Hao, for answering that question. I think it's so important for us to be able to know what kind of questions that we can ask our doctors, and even what we need to look out for prior to going to the clinic as well, because each person has a different experience with their doctors. If you are a bit more particular about learning more about information, find a doctor that suits you before you actually get into the treatment, because you don't have to meet the doctor for the first time and immediately get it done, right? Is that you can always go for consultation, so you don't have to worry about that. But I do have to ask this question from a dermatologist's perspective. Are there certain skin types or conditions that make someone more prone to complications?
Well, I think there are certain things that we have to look into, that aesthetics is something else for you to improve your overall appearance. So when you have underlying medical conditions, for example, if you're having diabetes, if you're taking certain drugs that's suppressing your immunity, or even if you're suffering from certain autoimmune disorders, not every single products are suitable for you, and you are also at a high risk of developing certain complications, for example, infections as well. So if you have that kind of things, I think it's better for you to consult a doctor and make sure that you can go through it well. And if let's say that you are someone else who are very, very sensitive in terms of the skin type, so there are also chances that sometimes after certain procedures, you might develop more intense redness, and also sometimes you're suffering from more swelling as well. So this type of things sometimes we may not be able to tell until we get it done. Yeah.
Interesting. So I have one added question for all the doctors actually. Would you advise that a patient gets like a full medical understanding of what they have prior to wanting to go for any form of treatments? Would you say so? Like a checkup? Because if it's, for example, like if you're diabetic but you don't know you have diabetes, or you don't know that you have autoimmune diseases, is it good to get a full body checkup prior to doing any aesthetic treatments? Do you think?
No, I think it's unnecessary.
Yeah.
But however, do just consult a doctor, and a doctor would usually ask the appropriate questions just to tease out. We will try to get some cues whether you have underlying conditions or not.
Okay, all right, thank you so much. I do have a few more questions, one of which to Dr. Lam. This is obviously something that every patient will want to know from a doctor's perspective. Like, what is your mega top tip for someone or anyone considering injectables for the first time?
Now, look for a trusted, qualified, and experienced injector that will understand your aesthetic concerns and then devise a plan together with you that will suit your aesthetic concerns, which may not include an injectable for all you know, because you think you need one, but maybe you don't. In the event you need an injectable, you may want to choose an injectable, for example, a HA derma filler, which you can dissolve it with an enzyme known as hyaluronidase if you don't like it, or if a complication arises for patients who are first embarking on injectable. Or if you do not want to do something that will change your look, choose an injectable, for example, a skin quality injectable that uses pure hyaluronic acid to improve the skin quality, a polynucleotide to reduce lines and wrinkles, or even botulinum toxin injections to relax your facial expression lines. They will make you look younger and more refreshed. And even if a complication does arise with botulinum toxin injections, they will all be resolved in 4 to 6 months. So I think these are some of the tips that you can use if you want to choose an injector.
You heard Dr. Lam. You write that down right now. I think it's very, very important to know all of this information as well, coming from doctors yourselves, because as much as we want to have the best doctor, we also know that doctors want to have the best patients too, that they are able to cooperate and understand certain things. Dr. Edmond, how can patients advocate for their own safety during aesthetic procedures?
Well, patient first need to understand this. Aesthetic treatment is not a regular facial treatment. All aesthetic treatments, whether it's needle injection involving needles or non-injectable treatment, comes with certain risks, and it should be done with proper training. We doctors are given the privilege to inject, not because we know how to inject, but because we know when not to inject, and most importantly, we know how to solve the problem when complications arise. That's the privilege given to us when we know that. It's important to get the injection done by a trained professional doctors and not just trust anyone that is promoting a beauty solution to you.
Very, very true. And that's the trap that we see a lot on social media these days, and talking about where do you actually source these products from for the injectables, which leads me to our final question to Dr. Stephanie. Where can consumers find more reliable information about injectables and safety?
Well, I think everyone goes to Google nowadays, but don't believe everything you see on Google. Go to the trusted official websites of the products, and there are also clinics, who just talk about the products. But I think more important than that, get the consultation to the doctor. Do some research on the various clinics and doctors and find one accredited one that you think you can trust, and do go for the consultation. Sometimes after a physical consultation, you may not be comfortable with that doctor. Feel free to get a second or third opinion. So yes, there are online resources, yes, there are social media, but don't believe everything you see and read there, and don't just trust ChatGPT and AI blindly. I think most importantly, find a trusted, accredited doctor.
All right, thank you so much, Dr. Stephanie, and thank you to all our doctors here. Now, it has been incredibly insightful, especially learning about the injectables complications. And I think, again, as I had mentioned earlier on, that this was not to scare you, but only for you to really open your mind of the types of questions that you should learn more about, find out more about before you actually meet your doctor. What are some of the things that you should ask your doctor? And hopefully the information that you learned today will give you that right decision for you to decide what treatment you like to go for, especially if it is an injectable. But this has been another episode of Elogio Aesthetic Insights, and my name is Diana Hashim. It's been a pleasure, and I'll see you soon. Bye!